Good morning, everyone. It is July 27th. Premier is back, so he'll be doing our overview, and then we're going to head right into questions. Thank you.
Ula sa kulumi July 27, sibulat diutak simalengat o kalamalaw tiluga perso si chao tigila ngayon.
Nunavut black chapel he utak simalak ni gama. Maanam ublum mitikin ligutana nuvan narjal 19 Nunavut iluaning ito holitana kuwenak taktok na waktu luarangama. Mama na mutikin libutak wak nuvan narjal 19 kangi mga ta kawihak tau himoy 1,719. Matakwa 225 huli utak kaya wud anyangi mga ta. Ikpakani ula Winnipeg mitana inutuhig mi hiniktawing mi ukwek hik kanilaw kapta takwa anyawing mudaw daktak tuta kingubahi lualaw mata utak kakatalo aktak sutita taku ublu 14 inutuhig mo itak nilusut ublu mi tiket lugu takwa katitlugi 170 ni Iqaluit tugod tay kani atok taw niak tuno inutuhig mi Matakwa mat na ako pagkatakwa pilireluk dalaw tutan ayong nakitulang mata na ukwakikan ng may tanang pagkasani Winnipeg mitakwa pilireluk tutan mat na pagka matakwa kabna nunani takwa Victor mayon ni provinces ni ilang itakwa nuban na 19 ang inglibad lelang ita mingmat ubalo ba aming ngok palelang mitatan takwa ukwak palelang yak tulugit tamani Nunavut iluaning itu wala taka malit siya kaya katabuhuli takwa nakanigi iluang ngiluta ublaluak tangin luta ama agawin ang mitya talawi takwa amihungok padle lang matakab dunanunani matnaw yung Nunavut miut nalat siya takapya matukuy humat siya kapya. Good morning. There are no confirmed or probable cases of COVID-19 in Nunavut. The total number of people under investigation to date is 1,719, and there are 225 currently being followed. Last week, we opened a second isolation hub in Winnipeg to accommodate the large number of backlogs for medical travel. As of today, we have 170 rooms, and we hope to have everyone currently on the waiting list in Winnipeg into isolation by early this week. I'd like to thank everyone who was able to get all the logistics together so quickly, and those in Winnipeg who have been so patient. The patients waiting to get into isolation hubs. We've seen cases rise in certain parts of the country in the last week or so. It is important that we all remember the very real risk that continues with this virus. We are not immune. COVID-19 is nowhere near over. Our public health advice matters. Wash your hands often, keep 2-meter distance, and stay at home if you're not feeling well. Thank you.
Kent Driscoll, APTN National News. Premier Savikataaq, for the past couple months, you and the health minister have both sat there and urged people to not travel out of Nunavut for the good of everyone. I remember the health minister saying, I don't want to get any of my friends and family sick. You don't want to overwhelm the medical travel hubs. When you traveled to Manitoba, you ignored that advice. Why did you ignore your own advice?
Kent Driscoll, APTN kunik sibulat di Savikataaq takyo si mayon ni makunik ibit ang maluan na hamnang itulari yung ministro mo kay nakatas na magatsaw lakatakoy yinasi tamakoy lagi yaw yun pikat na kayo yun lutay masayang makbiyo ko nagita na tusat siya langin na biyo ko sa rikatak tayo Manitoba mo suti ko sa kayong nakyo.
Thanks, Ken. It was a calculated risk, I guess. I checked out, waited till the travel restrictions were lifted in Manitoba. They hadn't had a COVID case in 19 days, and I limited my time there to 2 nights and 1 day. And I also went into isolation for 14 days. There was no cost to the government, and I did not have any human contact for 14 days while I was self-isolating. Matnaken tan ting mi ho ay ga ko tan Manitoba utak kelaw suta na itak tu lo law matata ko Nunavut mutat, Nunatsiam mutat, Matakwa, Alberta and BC mutat, Saskatchewan. Tana tuava sunga taikani gayaga lao sunga unnumago ublu atauha. Amma Nunavut utaramatana iglo lang ani sunga tai ublu 14 inung ni takung ni sunga taikani unutungin na sunga lao tunga.
You really didn't get to the question, though. The question was, why didn't you follow your own advice? On one hand, you're asking Nunavut to not go south, and on the other hand, you did it yourself. I'm just wondering if you can sort of align those two seemingly separate ideas.
Dana tiulangin na biapek tira tak tanga tamani no miuno tambalo tamakko asing itay maawla ka hatin nagit. Dana to kisinaktiga kan na nakipit yutinga.
Makes sense. As I stated earlier, it was a calculated risk. People, we have short summers here in Nunavut. People have boats they go boating with for their mental well-being, their hunting and all that. I own an airplane, and my son also flies it, and we only fly it in the summer. And it's a calculated risk I take, and I'll own it. And it was to use the plane. Otherwise, we wouldn't get to use it at all this summer. And that's about as best as I can explain it. Dan what's your halawama? Dan team ho aiga ako takwa when now you're 19 Manitoba mixli himalaw soni takwa Nunavut ilang au ila Nunavut mi au yabu nai tu nangumat takwa ilang umak to hostotit ta ting mi ho kagama ta ting mi ho uwanga ta yang na kangatata tigo ama au yakuin ato ho man ta na aigwa law so ato wa tigo ta na au yaw law na.
One more quick one on this, and then I'll move on. If you had the chance to make the choice over again, would you still choose to fly south to Manitoba like you did?
Tema naro kanao nam naro be piga kanalo te tema Suleimani Toba mo aula yake.
Yes, I would. It was a calculated risk, and I said, and I'll own it, and I'll speak to it. Any questions I get asked. I applied for isolation hub. I could have applied for exemption, and I may have got it, but everyone does their 14 days, and I wanted to make sure I was safe to keep Nunavut safe, and I submitted an isolation plan to the Chief Public Health Officer travel request, and it was approved. And since it was approved, I went ahead with it. Itan apering matan outlook to in kayalaw mga ating miho ay lugo kawi malaks ni dana kano himagayo mga ta nating miho atok takap ko aw yakut am atong naslugo am atok taw nas ni tating miho tay kung iswa kay mari titarak venu ta ukto aw mi outlet nga ta na inutu na ma igloya alam ta na angyak taw los ni Pigwa ko matana uktok tu la tunga tana inutuhim itingin lungata itakwa hanayit tamani ga kaktuno angyak tau yulwa mga uktok tu la tunga tana pigwa ngin nakuta ko Nunavut miud ublu 14 inutuhim mi tat mata wangata inutuhim mi wala tunga hiniktaving miung itu wala tiyan ublu 14 inung takung inaktunga.
Quick one for the health minister. Minister Hickes, with the announcement of a second travel hub in Winnipeg, does that mean the idea of a medical travel hub here in Iqaluit is off the table?
Minister Hickes na ay pangani Winnipeg may to yung may maturta yung kangatay malay halom ni tamahang to kajagun neka.
Thanks for the question, Ken. For the time being, we're able to deal with the capacity with the Winnipeg hub from the medical travel backlog. So unless that changes in the next little while, so I would say it's always going to be on the table, but it's not in play right now.
Man kay na dan na Winnipeg me tako takilaw tuit ini karon naksimata man na yutan na nalira ko tsagun ni kay naksimayo khaloy kisani 7 chatin ni sumatsak siyo tuit na kayali.
Hello, Métis Harvey, Radio-Canada. So to follow up on Ken's question on Iqaluit's hub, how would it cost you the same amount to operate it here in Iqaluit than operate an isolation hub down south?
Matis Harvey nalaw sa ikun ni Canada mita na Iqaluit tutabi wajal katay ma China ki khakayak katay ma China kalunani akigiyaw kataktumi.
Thanks for the question and welcome. We didn't flesh it out, go far enough down the path to see the full costing of it. There would be some different factors where we do have health employees here in Iqaluit that we could utilize for hub services, so it would alleviate some of those costs. But we didn't get far enough down the path to actually do a cost comparison.
Dana isumatsaksi ko daw tilugo nalo na ilo alaw nginatigo kano tiga ki khakayang mga kisani tama na hamnang ituliri ikune kanaya haktilu dat tamako aki khalo kayang ito pijit siraw te hamnang mut kisani khatsira kayang mga isumatsaksi ko daw law nito.
We're almost at the end of July. Can you tell us what's the stage of the negotiations with the airlines?
July nung nili katatako kano akilat taw na mga tahanga tayo liri ko nalo na taw sa malakhan.
Sorry, I missed the question.
The negotiations with the airlines.
We actually, the Minister Iqaluit, the Premier, and myself have a briefing later on this afternoon, so I'll know more then.
Tako to kisigaw titaw lang ayo Minister kaya ako sibulak tita nalo kaya manasaw lang ayon lusa.
Can you tell us why it's taking so long? Are there any points of contention?
Sumataman na ako ni taka kiso ni ang ikatigay ko na iliw ti sumabisi.
I don't want to lay blame anywhere. I think there, in these types of negotiations, when you have three different parties at the table, it can be convoluted and not so much confusing, but we don't want to make sure that we're not duplicating efforts that the federal government are doing. We want to make sure that the airlines are getting a fair amount that'll keep them operational, yet we want to make sure that these are taxpayer dollars that we're spending. We want to make sure that we're doing our due diligence and our analysis, but we are working with Transport Canada very diligently to come out with an airline support package.
Because last time...
Excuse me.
Oh, sorry.
Pasit sigumangit nga tako pinga sumatati miyo na aye ko to aye hatigi taman na nalo nak sigumangin ak malo gavamato hakko pilirang ni tako ni nga China pilirit tayli gumagatta tako alo hanga tayo ligit ikayok taw tsara hanga taw la tsara na hullogi tako alo taxi yak tinokina yan ato takata o jakso tsara hakso talo pilire hatta hakso tayo kayo ligit kun ni kanatami.
Thank you. Last negotiations, you seem to say that the discussions were complicated. Is it repeating again? Are there any elements that are complicated to discuss again? Or
Tako ay rutisi maayong natukko nakakatabi kisu matatako ayong natukko rutigiyasi.
Well, I guess when I say complicated, a lot of that work was done in the previous negotiation when we were looking at the financial information of what would sustain the airline industry in the north, not just in Nunavut, but NWT, Yukon, and Nunavut. So working with Transport Canada, a lot of those numbers per se have been clarified or agreed upon. It's just a matter of what share Transport Canada, what share Government of Nunavut is going to be responsible for, and coming to an agreement there. There is some complexities because from a northern standpoint, Yukon, NWT, and Nunavut, we have different needs of each territory, so getting those negotiations finalized with Transport Canada has been the delay.
Taman na ayong nalalaking ito kalo tamako bil rang wir sa mamata aje ko taw kali atilogi khanu tigiki na yani kino yali rin ang motora ngayon ito kasi sa hasi magatta ko binga suling ang mata nun at sa meu Yukon meu Nunavut meu lo bil malo kanatami kayo liriyak ko tamako to kasi nariyak kalo khatsiu ga kharning kasi ani khanu tigi gavamato hakko amalo Nunavut gavamakko akilina ang mga ta lalo na hakatigo tamako alo adjige ngin na hakngata Yukon meu nunat sa meu Nunavut meu pija kay alingit pilir hakatilo ta gavamato hakko kayo liriyak ko ngin.
Rajni Sharma, Nunavut News. Minister Hickes, last week we were talking about the behavior of the guests down south in isolation hubs. So my question is, the behavior of guests in isolation hubs, are they leading to a situation where the number of rooms or the capacity at the hubs is being decreased?
As ni Sharma Nunavut pivalia yuleri kunnik Minister Hickes pinasarusyo yume hayuga vitako na alat siya katangin matay lang ikalunani. Tuyok mi vinino tu kay naktitaw yunitako. Hatsin na kaya sa mga bata mat ini kaune hatak hatamako pidyo ti ilogi.
Sorry, just to clarify the very end, Raj, so is that impacting the capacity of the hotels?
Yeah, like are the number of rooms, like I'm assuming that the GN gets a certain number of rooms in the hotels down south. So I'm wondering, like, are there less rooms now provided as a result of the behavior of some of the guests?
Tako hatsin ng ilo si tuyok mi vinmikalunani hatsin na unaksawla katako to sa tilana alat siya katak si manginin.
Partially, yes. When people do break their isolation, they have to restart. So those are rooms that would be able to be, a new guest would be able to be checked into that is not available. So it is impacting the capacity. I think more importantly, or just as importantly, is the impact it's having on fellow travelers. The disrespect and the actions of some small portion of our population are making it even more of a challenging of a stay for guests that are trying to adhere to the rules, that are trying to get through this 2-week isolation period.
Ilang ago tako pigalak kikan nakataka kang natanalat sa ako na minutil logita ma pigalak kit si matil logita na asingin no initang gayak tu galo initang gunay lakat na taman nalo at tu nakakatang tako to yung may katingin nik tako nalat siya ng itilogit ma kangunak tukko sa katang ata ilay nang galo taman na tagat so naktukko tiyo sa mabutako mako ni pinasa ako sini ino tu kay nakakaktilogit.
I'm also looking for some detail as to why ultimately the GN decided to have a isolation hub in Winnipeg as opposed to Iqaluit.
Nalunaya kaya ako nakisum mata ko ino tu view kay nam na tu kalumni nga ako nila nga Winnipeg mi nga kanilang nga.
Obviously, our first choice is to keep people in isolation outside the territory before introducing it to our population here, and that was our preference right from the get-go. We were running into some capacity challenges and some logistics, so we had to do something. So we started looking at other alternatives to another Winnipeg hub, and Iqaluit was brought in as an option. So it's something we were looking at.
Taman na ilano na may saktaili tigo mas maluti ko ta nasibulak pa ngoyok tako sibulak pa may kalo ilano na go sila ta no to kay nakatata ko malaw kata kasi ayok naktukko kay naktilota Winnipeg mitan na kalo iso saksyo ko tiyo kay nato inalaw to.
Thank you. May I talk to Dr. Patterson? Dr. Patterson, can you provide us any updates on the in-territory diagnostic capacity, specifically what's happening with BioFire?
Luta Patterson ako siya akong nakitiguta ko kanulo lang mga takawisa ko titsayo pilok tumitaan natin to BioFire may kawisa ko ti.
Thanks. The BioFire in Iqaluit, the work on that to validate it is ongoing. It's an awful lot of work. One of the senior techs had put about 60 hours of work into that one machine and thought she was about halfway through it at that point. Plus there's work for other staff to do. So we're still a little more than halfway through, but we're not quite there yet for Iqaluit. I'll let Uli translate. Sorry.
Ana BioFire kawisa ko tiyo yung kalun ni suli kamagiyaw vadlayo nalo na yaktaw sa kaswakso ni at pilirang ugalim marialo matan nalo ang iyong kango nakpanga kawisa tulirin mo ikaka ni 16 ni matano kamasimayo tat sumunga tan abba ko tilitay nakto suli asingin no tay pilirang katakalo akilo ni kanayak tin kisani abba ngago lo akisan piyakit taw sumayo kawisa taw ni ngata nalo na yaktaw kaswami.
The renovations in the health center in Rankin Inlet are proceeding, and until those are done, we can't begin to work to validate the BioFire in Rankin Inlet.
Tagna sanayaw valle na bingani kangistin mi pigiak taw sumalak tuno tang gak taw lunita na inikat sa akong nakulugo kawisa ko tiyo yung BioFire na nakaktaw.
Also, would you be able to provide us with an update about what's happening with the travel bubble between Nunavut and Nunavik, or if there are any other discussions about travel bubbles happening in the near future?
Tusaptit sigaron na lirivli tamako aw lakatigigon na katang mga takano na lunay tawale ang mga Nunavut ang Nunavik asingilawit toksimabiyo.
Yeah, thanks. We had a discussion with some of the stakeholders involved in a Nunavik bubble. Not quite 2 weeks ago, literally the day after, pretty much literally the day after they announced that one positive case, and people weren't comfortable then. The plan was to wait 2 weeks and have another discussion, and that's coming up this week. Thanks.
Kuya namita ko ilaw katawgali kakatigi katas mayago tamako Nunavik miut awla katabigon na mga Nunavut miut nulota ko makupin asa ko si ukaw sarigalok titigo kaw to ang atay manalo na tayo kalangan no padyan aktutalay may makupin asa ko si nakan katitay mau kakatigi kan na naksilak tabi.
Jackie McKay, CBC News. My questions are for Minister Hickes. In regards to QC running isolation hubs down south, can you specify exactly what their role is there?
Jackie McKay, CBC, Kuni Minister Hickes, Tako, Pidutigil, Hicketala Cooperation, Kutujo, maybe in to view uni, Halunani, Hanuilok Tilari Mangata, Naluna Yagum Naki.
I guess in a nutshell, basically everything that we were doing previously, the intake, the dealing with any, resolving any issues, providing direction on how to access like mental health supports or any medical needs, as well as to just kind of oversee the whole, have boots on the ground, as they say. So we're looking at that, or through that contract, we're looking at having 3 people physically at each hub, so that they can deal with it, and to make sure that there's more Iqaluit speaking staff. So that's been one of the major positive advantages.
Nainalugo tako kaduili ko tigi katalok tatin ya tangit tu ni kanuili ko ti haktu surlo tu yung mibin mo palayo ni nalunay ya katasutik isimalo ti yunilo akitsu ya katigi katasutik ato ina hakti chillo tilo isimalo rin ang mo damalo na tulo rin ang mo ikayo tao galin ni tao na tao ni tu yung mibin ni sa makisutilo kayo sa kataktu ta contract ko tigo pingasuni ato ni tu yung mibin ni If I
can just add a little bit to that, I think one of the big advantages to the government of Nunavut is we have had staff that has been dealing with this supposedly off the corner of their desk, but it became a full-time job, I guess, basically. So it took away from the day-to-day operational needs that we have as a government, as a Department of Health, as Department of Community Government Services. So contracting that out actually allows our staff to focus on their duties.
Tana akaw na panguguti si mayuta ko Nunavut government kung kanayak tingin no kamagiyaw hatalaw ko ilanin ako kamagiyat sa kay na yugalo asutikisya ni kamagin naktaw gya hatali yung matawlo tama kanayangin ni kamagunnya sa tipilo aktami ane ham nang itulari kun na malunun alin ni government ko piyet sa atik kung hindi tayo mga piyet to ka nga ila kanayang ita to ka nga gini utit siya kung nakulog ita man nakaw na ako tingatan na contract house mayo.
Of the 3 QC staff at the isolation hubs, is there an Iqaluit speaker at each of the hubs?
Tako pinga si QC ko kanayak tingit inutito sunguva tako na nito yung midwin.
That is the intention. I don't know the staffing situation at each hub right now, Jackie. I can check into it. But the intention is to have the Iqaluit speaking staff at each hub.
Taman na pidyo tiga swalaw tanga tayo mahato nito yung midwin yun yung view kay nakita yun ato inautit sa kulugay nutito kung nakto niyo kalimasuni ikayo kung nakto ni.
How close are you to having those positions fully staffed?
Sorry? I missed.
Say it again.
Sorry, for the you said there was supposed to be 3 QC workers at each hub. How close are you to having meeting that goal?
Ako pinga su nakakauga bigato nito yung mibini kanu tige kanito le katako indot tao gaswami nitako ikayok titsaw yun.
I don't know right now, Jack. Yeah, like, I will check into the staffing, and for next Monday, if I'm not here, I'll have the numbers available.
Kaya mangito katsi mga kasi nagkadya ng ulak to mikiw kung nalak to siya. Tabaningi pa siya no kiw yaw kung nalak mi.
With the people we're hearing who need to restart isolation because of behavioral issues, what is this telling you about the state of mental health in the territory?
Tako inutuwin mi kay na kaya lepid yung tigilugi. Pigi alak kikat na kaya kangatan siya ngit tumini yung tilugi. Kano taman na iso magibiw, taman na iso malirin. Akaw ngiliw ko tao ni nga ninyo na bumi.
I'm really glad you asked that question, Jackie. I think, again, it's a very small percentage of the people, but they're bringing the vast majority of the issues. And I think in some cases, like I mentioned last week, it is mental health and addictions is obviously one of the triggers of the behavior, but sometimes it's just the behavior, just poor behavior, lack of respect for fellow travelers. One of the benefits that we have seen and have the opportunity to have is that mental health check-in that is occurring with all the travelers to help people identify that there are supports out there that they can access. So I think that that's one positive take out of the situation, is that at least people now are seeing that there are avenues that they can help address their personal needs.
Kuvet yung na perigon na kabiyo tako ilay na regalo ang katsin na regalo tamako akaw ngiliw ko ti akaw ngiliw ko ti usikatak to tamako ay sumalerin yung mulo ayok sa ko ti hamne mulo tamako alo ilan ni ko nalat siya ng ito inak to kano yung Iqaluit sotik ang malo to yung may hati miniki ma pitsia katun ni katak to tamako alo taga pivale ko ti usimabu tamako ay sumalerin yung mo ato inaw ningin ni kaw yigiak tayo katang ata ato yung nakakaunang ningin ni kaw dyan lang pahalirong naktot sa buta makwa inusok mini akaw ngiliw ko tihakto no.
We're hearing that sometimes when country food is dropped off at the isolation hubs, the packages are not being delivered. Why would that be happening?
Tako inulit tayo ni kaya ato yung nautitaw lang ayong Iqaluit tilog ito yung may bino sumata ko ilan ko ito yung may bino ko dyaw katang yung mga ata.
I'm not aware of any specific instances like that. I do know that there is parameters that have to be followed to be able to drop off packaging. We're trying to, again, this is an isolation hub. We want to make sure that people are kept isolated. And that includes handling any boxes or packages or anything like that. There are protocols that are in place. From what I'm aware of, it is still possible to drop things off. But again, it would depend on the hub and the storage ability for country foods as well, too. I can't speak to that specific example.
Kaya mangito ta na to sa lawit to tamat sumamit sanot tako ima to yung may bimo ko dyaw kataka haptilugit ima maligya hang ata tamakko kano sa maktaylitit sinang mo isumalo ta kakata ilanik ko kay tayo maayong nahatatot sa ilang ilo ni kwa ka ta hang ito nakahang ata taman na nalunay ron nalatangin tanga mahanaw yo.
Dustin Batard, Nunavut News. Question is for Minister Hickes. The new isolation hub in Winnipeg, is that temporary or just to get through the backlog, or is that full-time now?
Dustin Batard, tan Minister Hickes, tan na Winnipeg meet to matutaw kanila to matuyo nga kain nato yung nang to tako takhiyo ne kata matuyaw laka.
Thanks, Dustin, for the question. It was originally set up to deal with the surge capacity for medical travelers. Now that we've got it up and running, as medical appointments are continuing to increase, as other jurisdictions, including Winnipeg, are starting to have more openings of services, we are anticipating needing that hub probably till the end of the isolation process. We want to make sure that the supports and everything are there for our medical travel patients. One of the things that we're working with Dr. Patterson on is creating a medical travel bubble, so that maybe people don't have to do the full isolation. If we can contain and control all the contacts that people would come, all the people that our medical travelers would come into contact with. So this is a stage of that developing practice.
Pinna mi atariga bitako ami songo ka kay na law tilugi pilwak timi anyak biliare li tamakko init saliw kan ne hatta kon naksim mata matu palle alak tilugi ilagi yawlu ni Winnipeg tako matu ngani asogi javu tamanna nalaw ngin nilimangin ni inutu kay na hatta kaya harnik tamakko ikayok sukta hulugi anyak biliare hatta tu awla li luta Patterson piliri hatta usim mata matu munga isumasaksi uti hakon kaswak tu tako awla hatta luti ma utakikay na kaya tungit luti isumasaksi uti tuin na kaya liti makayo mayagun na tuwa kata awla tagun na luti lukik kunni kati sistema mangata tayo mga isumasaksi uti ubali amiyo.
Thank you. Next question is, so right off from the start of the second isolation hub, it's run by QC, correct?
Tanay patuloy matuyak tayo QC kuno awla tayo.
No, it's not. It's operated by the Department of Health specifically.
Aga anaham nang ituloy kuno awla tayo.
Thank you. And what's the status on country food meals in the isolation hubs?
What's that?
What's the status of country food meals?
Tako inulak tanin ni kita katang nga kanu iling alakhan.
So we have partnered with Nunavut Incorporated to provide the shipping, and we're looking at with our HTOs and with our partners of providing country food, and we're looking at right now an initial meal replacement. We're looking at aiming at 3 times a week right now in Ottawa, and then it's going to roll out to the other hubs as we streamline the processes.
Taman na ilagay jayo Nunavut nga bikku kayo katayo ta ko awlak tit sa katako na umata malo nunalin na nga sutulay ko katud sa katigingin ni kayo ta sutaman na yo ta ko isuma sa ko tiyo si mayo nirika ta katako lugit pinaso ako si Ilo ni Arawa mi asingin nilo ato na titaw lakin lut kingon niago.
Thank you. And when do you expect that to start, or if it started already?
Ang anak ko pigya akong nalangan.
Sorry.
The country food, when do you expect that the 3 meals a week to start? Or has that started already?
Sorry, I was waiting for the interpretation. My apologies. It's starting this week in Ottawa.
Taban ipinasawa sa pigya lak to Arawa mi.
Thank you. Any more details on the 18.9 million, how that's going to be spent? I know last week that you said that to be determined.
Pinasawa ko si Yumita ko 18.9 million kano atok taw lang mga tanaro na taw sa Malakay.
So approximately 12 million of that is actual transfers. The rest is shared, cost shared at different programs and policies that we're going to be rolling out in conjunction with the federal government. The rest is basically spoken for in different categories. I don't have my notes in front of me right now, Dustin, but basically it's to help, obviously, with the transition of COVID-related programming.
Takwa 12 million, takwa tukok taw na apto kino yak kubingin ilang itakwa akilas suya katigi ko taw na apto pilire ano gava matokak ko pilire kataw lutik at jiging itunod luna yak sa mayon takwa atok taw lirir na apto takwa na luna yak sa mayon iman na pitakang makisani nuwadyo anak 19 duha ngayon.
Thank you. That's my last question, and also from Minister Hickes. Why was there no long-term funding agreement between the GN and Canadian North, kind of similar to what Quebec has with Air Inuit?
Sumali ako niyo yung mata ko Canadian North kuno kina yan kayo tini dalo na sisimang nila si no nabimili. What's the airline in Nunavut?
Air Inuit?
Air Inuit ko tayo may kayo sukta matali.
Thanks, Dustin. I'm not familiar with how that agreement was established or the length of it. I know initially when we first sat down with the airlines to come to some type of an agreement, it was happening so fast. The travel restrictions were changing all over the country, all over the world, so we had to react very quickly. Then when we had time to sit down and really crunch the numbers and go through the financials from the airlines and establish a baseline, now it's still subject to change as there's still increasing travel. There's still increasing business travel, contractors that are flying north. So the volumes are going to be changed. So that's something we have to keep cognizant of. So it's not as simple as just snapping your fingers and okay, amount X will cover you.
Tanala tusaumallo ang itakatay na kano ang irutaw si mga ang takwa kano tigiw na mga talutaw na ni hanga tayo lirino kayo tiyuyut. Taman na kila may alok ko piyak palala nga tamak ko alo aw labbi kung nakto isulit tak bitaw palalak tilugit kamagit sa tigiya kalaw kat tigo maluking unyagit. Takwa hanga tayo lirino piliri katigil tigo kinaw ya lirinak mo takwa udyak sa palat sa lilaw kat tigo suli asid sukta kong nang kata tamakko ala aw lakat tapalya nak saulak tillugi tamakko ujiri tsara hakatti ko tayo kilami uyok ko ayong nangit tukulo tillugi tayo matsay tsaw tigi akiligon nangin nata.
Kent Driscoll, APTN National News. I'm not certain if this one's more for Dr. Patterson or for Minister Hickes, so you guys figured that out. Medical travel patients, do they get priority over other travelers when going into the isolation hubs, or is it a first come, first served basis?
Kent Driscoll APTN kun niluta Patterson imbillo ni kuy kun naktay takwa anak bilaktod siwulak pa titaw katakata kun nga tuyok may vimmo inuto ko vimmo taw kun nakningin asingin ni.
Simple answer, yes. Medical travelers are prioritized over general travelers, with I guess an asterisk. If you were traveling, Kent, and you booked an isolation hub appointment, we'll say your check-in date, you know that sometimes weeks in advance, so you can schedule that. When people are medically cleared, we don't get weeks of advance notification. It's you're in the medical system, all of a sudden you're cleared, you're available tomorrow. So how we can fit you into that schedule may be a day or two or three, or as we found in Winnipeg with the capacity issue, up to weeks, which was why we've addressed that separately from the other contracted isolation hubs. So that's how we're dealing with it there. But medical travelers are prioritized.
Takwa anak bilato sibulak pa titaw katak tamak kuning asingin ni tiki kaswakto ni pichuti kalawakatik. So look han initially na rovita ma to yung may vimula ni tay ma initially taw gayak to hangak ko isirun na la kayang mga pito yung may vimot pinasa ako sa kasay sibong wago kasi anilita ko anak bilas mayo kano igun nang nakaktaw gay mata ang karon nang nakaktaw gay mata so lukaw patsaw tigaw lagon naksigalo akso ti kasi ani sikun na ilis makatak to tayo maulo ni ataw so makto ni pingasunilo ni ilanik ko pinasa ako sigalan ni utak higakak to kakatak sa mayok tayo may maimik ko anak bilato ni sakya sila ko contracting ko to yung may vimino to be okay nakatakon nakto mo.
And
For the interpretation.
And just to put a plug out there, Kent, for anyone that is not on medical travel that are traveling and needing to come back to Nunavut, please book your appointment as soon as possible.
Tanalo to kasi naptitaw gaya ko lugo tako na bilang ito aw lang na katatay man init saliw sa tigi katakaya liw tek palala ng minik sibongat ko.
This is the time of year we usually get a lot of ships in the Northwest Passage, and this year we're not allowed to have cruise ships. Now, in past years we've had ships arrive unannounced or by surprise. I'm wondering, have there been any surprise boats arrive this season that would cause any concern with medical issues?
Sabani tamani akka gumiaw yaw tilugo umiaw jo atiki katang ata pilo atumi pula katinut tapani lo kang so alok ko hangi mataw kiyok taktumi pula kati umiaw jo ata kunung ali tikit to kalaw sumaba nalo na yung sismangit to ni sibong gago umiaw jo ani.
Thanks for the question, Kent, and I do know that the federal government has put restrictions in place as well as the Nunavut government, and I looked over to Dr. Patterson to confirm. From up to last week, there's none, and Dr. Patterson just confirmed since then there has not been any surprises in that regard.
Kung nami Kent ako government to hakot to no kaktit si mama to bago to Nunavut government kung ipinasa ako si Uyo Minon luta Patterson to kisiga biya katang ima tikit to kalaw sumangit to nalo na sumangit to ni sewong ago merjoni.
Mathieu Sarvé, Radio Canada. Maybe I missed something, but how many isolation hubs are there at the moment in Winnipeg?
Mathieu Sarvé to kisil pala katangin makatsiyo batako to yung review to Winnipeg menu to view kay nakatayali.
Right now there are 3.
Man now you pingasun.
With the one for construction workers?
Kay nalo sa nagyaktok to nilangan.
Yeah, so there's a general travelers isolation hub, a medical traveler isolation hub, and a contractor isolation hub.
Tamang wakaswak no pidyo te kalawang ito no inutubiyo kay naktutudyong may vikang maloan na bilayak tunot ang malo sa nagyak tuktuno surlo inluliyak tino. Tingaso.
Thank you. Were there any kinds of police interventions in any of the hubs down south?
Any what?
Police interventions?
Oh, palis kuno kamagayaw yung kakakalaw sa mabataw na ni.
I don't know any numbers, but there has been.
How yung mga ito katsi yung mga takisya ni ito sa simayo tayo mga palis itaw kaya kakatak simayo ni.
Do you know where?
Nami yung mga
Again, I don't have the accurate numbers. I do know there has been instances in Ottawa and Winnipeg. I'm not aware of any in Yellowknife or Edmonton, or Quebec City.
ito sa simayo katsi yung mga talo how yung mga ni kisya ni nalo nang ito Ottawa may Winnipeg milo tayo mga palis itaw yung kakatak kaya kasimayo. How yung mga ito Yellowknife, may Edmonton, may Luni, Quebec City, may Luni, tayo mga kaungiliro tayo kasimang mga ata.
What's the total value of a 14 days isolation for one person?
Katili mga lugi, kat siya kakayak kaulo ni 14, ni tayo yung may minutuga, hakti tayo yung hakti lugo.
If I recall correctly, when we first started setting up the contracts, it was about $4,700 for the first person in a room.
Sibulat pa kami tayo na contract, nalo na tayo walalak tilugo, tusak sumaya ka $4,700 at tayo sa mo inum mo.
So as of mid-July approximately, your department had allocated $15.5 million to the isolation hub, and this number doesn't include the ones for construction workers. Actually requested that number, but I'm still waiting for it. So how much money do you figure you'll be able to sustain a program like that for the 6 next months and for a year?
July kitiya ni tako kat siulat talo mga tatako 15.5 million sana baktaw si manera yuga bigito yung midino ni tu kay na biugalin no tana ilagiliw si mga tako no iluliyot tino ila tuyong midi haktit sinang mo tako lo kat sinya kinaw yan ni ato nakakahang na kisita ko makit mayaw siya kataw na hulugi takyo na ato ni pingasuyok to ni abalo ni akaguli mama.
Thanks for the question. So we've spent approximately 12 of that 15 million so far. So we know what we have left is not going to go much further, especially now that we've opened up that medical travel hub. So that's today's analysis. We're going to be looking at that, as a matter of fact, later on this afternoon. But it's so volume dependent that it's hard. We can project as best educated estimate or educated guess, I guess you could say, in a lot of ways. But we're monitoring on a daily, at least weekly basis of intake volumes, where that will help us, help guide us, I guess, in estimating the cost going forward.
Kuya namita ko 12 million atok taw sa malirik to tako ng $15 million ni tako Ameriko halo dagon niya ata pilo aktimita naan na bela aktin no yung may matuyat taw sa malirik tilugo ulo mi kaw yiga lang kalo aktigo hatsi mga ta kinaw yatok taw gali unno sa tanayla hatsi hatam ningin no pidyo te halo ang tamakkwalo surlo ko tigi gaswato nakatak tabo sana kaw isak panlangin naktabo ulo tama pinasa ako si tamalo tamakwa hano tiga te kakayang mga ta kaw yiga sa katang maluta.
Rajni Sharma, Nunavut News. Minister Hickes, what happens to the medical travelers when they cannot find a spot in an isolation hub down south? Where do they stay?
Rajni Sharma, Nunavut News kun ni Minister Hickes takwa na bilang sa mayo tayo maini haktin nagisulit yung may vimina may katakas.
For Nunavut Inuit, they would be at the boarding home. If you're on extended health benefits, medical travel, then you would be at a hotel. But you would not be considered as part of the isolation. You're still under your medical travel agreement.
Nunavut Inuit takwa na bilang sa mayo tuyok may vinni katak to tako nga na bilang to no tuyok may vinni obalo ni hotel ni tuyok may bilakin ni tako ni nalo na taw sa mangito ni utak kitilog itay ma nalo na taw sa mayo no tuyok may vinni no tuyok mo lang ningin.
If I may, just to add to that, and that is what created the need to look at additional hubs. As an example, if somebody were to fly down for a medical appointment, they could be there for 2 days, they go for their medical appointment, and then have a 3-week waiting period before even getting into the isolation hub. That would be on the government of Nunavut to cover those costs. So it's works. The demand is on us to lower our costs. So that's where it was more cost effective to bring in another isolation hub.
Anna ilaga arlugu taanna khimikuga harsimagatigo ilaja kullugi tuyormivikannarmik iniharunni hattalaongata taima takujaugaartoq harsimarannerbeleartu harsimatillugu ulluinnaanni maqqunni pijariiqtauju haqqaat pinasaaruserni pingassuni ilangi utaqqeqattariaqalaongata inutuuvimmuulaunginninginni tuyurmivinnu tamannaakkitu qattalaunga Nunavut gavamakkunginnu taimaimmat Sakirtauju hakkannila qutujurmivimmi initsami tamannaik akinga aulataukannernersaugunnaqulluk.
The last question. So presently, there are discussions happening about having a medical travel bubble between Winnipeg and Nunavut?
Makakatigilaqisiitaako lahattarbiugumnarnaa mangata inutuugiatukainnahattangilluti Winnipeg miutammalu Nunavummo.
Thanks for the question. And these are early discussions, but what we're looking at right now is not per se a jurisdictional bubble, but a medical traveler bubble. If we can control, like as an example, right now we've got people in isolation that may still have follow-up appointments. We will work with the medical team to make sure that all PPE and controlled travel to that appointment and then back into the isolation hub so it doesn't break that isolation. So what we're looking at is possible ways how we can have somebody in medical travel stay within our controlled environment all the way through so they don't actually have to go through a full 2-week isolation because they've been kept in a controlled environment the whole medical trip.
Innamiitaan uqausiuqallialitainnartuuqtamakku aulahattarbiugumnatuinnaqayangittu kikkulimaanu kisianiarnaarbilaartuinnarnut taimaisumatsarsiuqutaussimajoq taimaa suulutakujaujohariartutillugu initsaliortaujumarsuuqartillugu aannaarbilaartuni taimaa timimmuut sapummijauguttini atutsiaqattarlutik aulatautsiarlutillu namungaqattarunnarningi taimaa utaqqigiatuqattarunniiqajangata aannaarbilaarsimajo Qallunaanuraaqartillugi pinasaarusiinni maqquunni utaqqigiatugajangilluni suli tamannaisumatsarsiuqutuutuinnarsimajo.
And just to clarify or re-clarify or clarify my own words, when I was looking at the numbers for the construction hubs, I noticed Winnipeg is on the decline, and I was just informed that we've actually closed the construction hub in Winnipeg, and that the small number of construction workers that are coming up are in the general isolation hub right now that the capacity issue has been dealt with the medical travelers.
Sinartigiarlugu taakua qatsiunningi sanagaartortu Nunavummi qanayartiit Winnipeg miqatsiinnaruqqaalliartumariulaungata taanna matujaussimalertu sanagaartortunu tujormiviukainnaqattalaortu taakkununga asinginnu tamaunga Nunavummu teqqalliajunnu taikani tujormivimmi qattautuinnaqattalertu.
Jackie McKay, CBC News. This question is coming from the public. People are asking if elders can be sent home right away and self-isolate at home instead of the isolation hubs.
Jackie McKay, CBC kunnitaakua innai piddutigillugit aperijoqarsimamataakua tujormivimmigiatungilluti taimaangeqartitautuinnaqattarunnarmangaataangeqqangaamini innutuukainnangaaqattarunnarluti.
I wish I could say yes to that. I know it's especially challenging for elders, away from their families, away from their supports, away from their traditional foods in a lot of cases. Unfortunately, the reason why we've had to create these isolation hubs is people not adhering to their self-isolation at home. So we can't permit that. It's too risky at this point.
Angerunnaqu magaluartunga kisiani tamannaayornartu manalunangittu innarnuun piluartumi neqigisuunginni atuinnaqarunniiqattangata taimai mataakua inutuukainnariaharbiutitauqattarsimavuun amisu maliqattarsimangimmataa taimaimmaat uluqianaluanga maannaayo aaggat aanangerunnangitavu.
And just a reminder that next Monday is a civic holiday, so we'll be doing our update on Tuesday.
Thanks, everyone.